Everything you need to know about masturbation. Masturbation is a natural and common sexual activity that involves self-stimulation of the genitals for sexual pleasure. It is a normal part of human sexuality and is practiced by both males and females of various ages and across different cultures. Physical and emotional benefits. Masturbation has several potential benefits. It can help release sexual tension, promote relaxation, improve sleep, and provide a sense of pleasure and well-being. It can also help individuals learn about their bodies, preferences, and sexual responses, which can enhance sexual relationships with partners. Safety and hygiene. Masturbation is generally considered a safe and healthy sexual activity. It doesn't carry the risk of sexually transmitted infections, STIs, or unwanted pregnancy. However, it is important to maintain good hygiene by washing your hands before and after masturbation to prevent the spread of bacteria. Techniques. Masturbation techniques vary from person to person, as everyone has unique preferences. Some common techniques include using the hand to stimulate the genitals through rubbing, stroking, or applying pressure. Some individuals may also use sex toys, such as vibrators, to enhance pleasure. Frequency. The frequency of masturbation varies greatly among individuals. Some people masturbate frequently, while others may not engage in it at all. It's important to remember that there is no normal frequency, and it ultimately depends on personal preference and comfort. Myths and misconceptions. There are several myths and misconceptions surrounding masturbation. It is important to dispel these myths, such as the belief that masturbation can cause physical or mental health problems, or that it can lead to infertility. These claims are not supported by scientific evidence. Cultural and religious perspectives. Attitudes towards masturbation vary across different cultures and religions. Some cultures and religions may view masturbation as taboo or morally wrong, while others may accept it as a natural and normal behavior. It's essential to respect individual beliefs and values regarding sexuality. Communication and consent. If you're in a sexual relationship, open and honest communication with your partner about your sexual desires, including masturbation, is important. Discussing boundaries, consent, and mutual pleasure can help create a healthy and fulfilling sexual relationship. Potential concerns. For most people, masturbation is a normal and healthy sexual behavior. However, if it begins to interfere with daily functioning, relationships, or responsibilities, it may be worth discussing with a healthcare professional or therapist. Remember, masturbation is a personal choice, and what is important is that it is practiced in a way that feels comfortable, consensual, and respectful to yourself and others. If you have specific questions or concerns, it's always a good idea to consult a healthcare professional or a qualified sex therapist. Masturbation can have positive effects on your sex life in several ways. Self-exploration. Masturbation allows individuals to explore their own bodies, learn about their unique sexual preferences, and understand what feels pleasurable to them. This self-awareness can enhance sexual experiences with a partner by providing guidance on what types of stimulation and touch are most enjoyable. Improved sexual function. Regular masturbation can help improve sexual function by increasing blood flow to the genital area, maintaining healthy sexual arousal patterns, and promoting overall sexual well-being. It can also help individuals become more comfortable with their bodies and sexual responses, leading to increased confidence during sexual activities with a partner. Stress relief and relaxation. Masturbation is a natural way to release sexual tension and promote relaxation. It can help reduce stress, improve mood, and provide a sense of well-being. By engaging in self-pleasure, individuals can experience the physical and emotional benefits associated with sexual release. Enhanced sexual communication. When individuals explore their own bodies through masturbation, they can gain a better understanding of their desires and preferences. This knowledge can be valuable in sexual relationships, as it enables individuals to communicate more effectively with their partners about their needs, boundaries, and desires, leading to a more fulfilling and satisfying sexual connection. Increased libido. Regular sexual activity, including masturbation, can contribute to a healthy libido. Engaging in self-pleasure can help maintain sexual desire and arousal, which can positively impact one's overall sex life. While masturbation can have positive effects on one's sex life, it's important to note that every individual is different, and what works for one person may not work for another. Additionally, maintaining open and honest communication with a partner about one's sexual desires and needs is crucial for a healthy and fulfilling sexual relationship. Masturbation is generally considered a safe and healthy sexual activity. However, it's important to note that individual experiences and circumstances can vary. Here are a few potential drawbacks or risks that some individuals may encounter. Guilt or shame, cultural, religious, or personal beliefs can sometimes lead to feelings of guilt, shame, or stigma associated with masturbation. It's important to acknowledge and address these emotions, as they can negatively impact one's overall well-being and sexual self-esteem. Open communication, education, and self-acceptance can help navigate these feelings. Overdependence or compulsive behavior. While masturbation itself is a normal and healthy sexual activity, some individuals may develop compulsive or addictive patterns of behavior. If masturbation becomes excessive to the point that it interferes with daily life, responsibilities, relationships, or causes distress, it may be worth seeking support from a healthcare professional or therapist. Physical discomfort. Engaging in masturbation with excessive or vigorous stimulation, or without proper lubrication, can sometimes lead to temporary physical discomfort, such as genital soreness, irritation, or chafing. Using appropriate lubrication, taking breaks when needed, and being mindful of one's body can help prevent such discomfort. Interference with sexual relationships. If an individual relies solely on masturbation for sexual gratification and neglects their partner's needs or desires, it can potentially lead to relationship issues or dissatisfaction. Open communication with one's partner about sexual desires, preferences, and finding a balance between self-pleasure and shared sexual experiences is crucial for maintaining a healthy and fulfilling sexual relationship. Unrealistic expectations. Frequent exposure to explicit or exaggerated sexual content, such as pornography, can sometimes create unrealistic expectations or distort perceptions of sexual encounters. It's important to recognize that pornography often presents scripted and fictional scenarios that may not accurately reflect real-life sexual experiences or dynamics. It's worth noting that the potential drawbacks or risks associated with masturbation are not experienced by everyone, and many individuals engage in masturbation without encountering any negative consequences. If you have concerns or questions about your own experiences with masturbation, consulting a healthcare professional or a qualified sex therapist can provide personalized guidance and support. Determining if masturbation habits have become compulsive or addictive can be a subjective assessment, as it depends on individual circumstances and personal experiences. However, here are some signs that may indicate problematic or compulsive masturbation. Interference with daily life. If masturbation starts to interfere with daily responsibilities, work or school obligations, relationships, or social activities, it may be a sign of compulsive behavior. For example, if one frequently chooses masturbation over engaging in important activities or neglects personal and professional commitments due to an overwhelming urge to masturbate, it could indicate a problem. Loss of control. Feeling unable to control or stop the frequency or duration of masturbation is a potential red flag. If attempts to cut back or stop masturbating are unsuccessful, or if there is a persistent sense of being driven to engage in the behavior despite negative consequences, it may indicate compulsive tendencies. Negative emotional impact. Compulsive masturbation can lead to negative emotional effects, such as feelings of guilt, shame, or anxiety. If someone experiences distress, self-esteem issues, or emotional turmoil related to their masturbation habits, it might suggest a problematic pattern. Escalation of behavior. A significant increase in the frequency, intensity, or duration of masturbation over time can be an indication of compulsive behavior. If someone finds that they need more and more stimulation or time to achieve the same level of satisfaction, it may suggest a potential issue. Neglect of other sexual opportunities. If an individual consistently chooses masturbation over engaging in sexual experiences with a partner, it can indicate a problem. Avoiding or neglecting opportunities for shared intimacy and sexual connection may be a sign of compulsive behavior. It's important to note that experiencing occasional intense sexual desire or engaging in masturbation frequently does not necessarily mean it is compulsive or problematic. However, if these behaviors consistently interfere with one's daily life, relationships, or overall well-being, it may be beneficial to seek professional help and support. Consulting with a healthcare professional or a qualified therapist who specializes in sexual health can provide a proper assessment and guidance based on individual circumstances. There are various techniques and tips that can be helpful for females who want to explore masturbation. Self-exploration. Take the time to explore your own body and discover what feels pleasurable to you. Experiment with different types of touch, pressure, and stimulation to find what brings you pleasure. This can involve exploring the clitoral area, the inner and outer labia, and the surrounding erogenous zones. Clitoral stimulation. The clitoris is a highly sensitive and erogenous zone for many females. It can be stimulated with the fingers by gently rubbing, circling, or applying light pressure. You can also try using a vibrator specifically designed for clitoral stimulation. G-spot stimulation. The G-spot, located on the front wall of the vagina, can provide intense pleasure for some females. Inserting a finger or a curved sex toy and using a come-hither motion to massage the area can be pleasurable for some individuals. Experiment with toys. Sex toys, such as vibrators or dildos, can be a great addition to solo play. There are many different types and designs available, so you can explore what works best for you. Some toys are specifically designed for clitoral stimulation, while others can provide internal pleasure. Lubrication. Using a water-based lubricant can enhance comfort and pleasure during masturbation. This can be especially helpful if you experience any dryness or discomfort. Mindfulness and relaxation. Creating a comfortable and relaxed environment can enhance the experience. Take deep breaths, focus on the sensations in your body, and let go of any distractions or stress. Fantasies and erotic material. Incorporating fantasies, erotic literature, or visual stimuli can add to the arousal and pleasure. Explore your imagination or try reading erotic stories or watching adult content that aligns with your preferences. Remember, everyone is unique, and what works for one person may not work for another. It's important to listen to your body, be patient, and explore at your own pace. The key is to prioritize your pleasure, comfort, and consent throughout the process. Masturbation and sexual intercourse are distinct experiences, and they serve different purposes for individuals. While masturbation can be a pleasurable and satisfying sexual activity, it typically differs from partnered sex in several ways. Connection and intimacy. Sexual intercourse often involves a shared experience with a partner, which can foster emotional connection, intimacy, and bonding. Masturbation, on the other hand, is typically a solitary activity. While it can still provide personal pleasure, it may not offer the same level of emotional and interpersonal connection that can be experienced during partnered sex. Variety of sensations. Sexual intercourse involves the interaction between two bodies, with the potential for a wide range of physical and sensory experiences. Masturbation, while it can offer pleasure through self-stimulation, may not replicate the same complexity of sensations that can be experienced during partnered sex. Emotional and psychological aspects. Engaging in sexual activity with a partner can involve emotional and psychological elements such as desire, attraction, communication, and mutual exploration. These aspects can contribute to a deeper sense of satisfaction and fulfillment that may not be replicated through masturbation alone. It's important to note that the role of masturbation and sexual intercourse can vary among individuals and relationships. Some people may engage in masturbation as a complement to their sexual experiences with a partner, while others may prioritize one over the other. There is no universal rule or expectation regarding how individuals should approach their sexual experiences. Ultimately, whether masturbation can replace sex depends on personal preferences, circumstances, and individual needs. Open communication and understanding between partners are crucial in navigating and negotiating sexual desires, boundaries, and expectations within a relationship. Last but not least, masturbation does not cause premature ejaculation or erectile dysfunction, softness. In fact, masturbation is a normal and healthy sexual activity that can provide pleasure and help individuals explore their own bodies and sexual responses. Premature ejaculation and erectile dysfunction can have various causes, including physical, psychological, or medical factors. It's important to understand that these conditions are not typically caused by masturbation itself. However, excessive or compulsive masturbation, along with other factors, such as anxiety or stress, could potentially contribute to temporary difficulties with ejaculation or maintaining an erection. If you experience concerns related to premature ejaculation or erectile dysfunction, it is advisable to consult a healthcare professional or a licensed therapist who specializes in sexual health. They can provide guidance, support, and appropriate treatment options based on your specific situation.